Croup is a common respiratory condition that primarily affects young children, typically between the ages of 6 months and 3 years, though it can affect older children and, in rare cases, adults. It is characterized by inflammation of the upper airways, including the larynx, voice box, trachea, windpipe and bronchi. This inflammation leads to a distinctive barking cough, hoarseness, and, in more severe cases, difficulty breathing due to airway narrowing. Causes of croup. Croup is usually caused by viral infections, with the most common culprits being influenza virus is the most common cause. Respiratory syncytial virus (RSV), influenza flu viruses, adenoviruses and other respiratory viruses. Less commonly, bacterial infections can cause a more severe form of croup, known as bacterial tracheitis. Symptoms of croup. Croup often begins with mild cold-like symptoms, such as a runny nose or mild fever. As the condition progresses, classic croup symptoms develop: barking cough, a deep, harsh, and barking sound similar to a seal's bark, most noticeable at night and can worsen with agitation or crying. Stridor, a high-pitched, wheezing sound that occurs during breathing, especially when inhaling. It indicates airway narrowing and can be heard when the child is at rest or becomes more pronounced when they are upset. Hoarseness, due to swelling of the vocal cords, the child's voice becomes hoarse. Difficulty breathing, rapid or labored breathing can occur, especially in more severe cases. Fever, a low-grade fever is common, but in some cases, the fever may be higher. Symptoms worsen at night. Symptoms tend to be worse at night, with episodes of coughing or stridor often causing the child to wake up. Types of croup. Viral croup, the most common form, usually caused by viruses like influenza. Symptoms are typically mild to moderate, with a barking cough and stridor. Spasmodic croup, similar symptoms to viral croup but without a preceding viral infection. Often occurs suddenly, typically at night, and may recur. Bacterial croup. Bacterial tracheitis, the more severe, but less common, form of croup caused by bacterial infection. Symptoms are more intense, and medical treatment is usually required. Diagnosis of croup. Croup is typically diagnosed based on clinical evaluation, including the review of symptoms and a physical examination. The doctor will listen for the distinctive barking cough and stridor. In most cases, no additional tests are required, but in more severe cases, or when the diagnosis is unclear, the following may be used. Neck X-rays, to rule out other causes of airway obstruction, such as epiglottitis, a more dangerous condition that also causes breathing difficulties. Oxygen levels, a pulse oximeter may be used to measure oxygen levels in the blood if there are concerns about breathing difficulties. Treatment for croup. Most cases of croup are mild and can be managed at home, though more severe cases may require medical intervention. 1. Home treatment. For mild cases, keep the child calm. Crying or agitation can worsen symptoms, so it's important to comfort the child to help them relax. Cool mist humidifier. Adding moisture to the air can soothe the irritated airways. A humidifier or sitting in a steamy bathroom can help. Hydration. Ensure the child drinks plenty of fluids to prevent dehydration. Cold air exposure. Sometimes taking the child outside into cool, moist night air can ease breathing and reduce coughing. Elevating the child's head. When sleeping, elevating the head slightly may help ease breathing. 2. Medical treatment for moderate to severe cases. Corticosteroids. A single dose of oral or inhaled dexamethasone or prednisolone is commonly given to reduce airway inflammation and improve breathing. Nebulized epinephrine. In more severe cases, nebulized epinephrine may be administered in a hospital setting to quickly reduce airway swelling and improve airflow. Oxygen therapy. If the child's oxygen levels are low or they are struggling to breathe, oxygen may be provided. Hospitalization. If the child has severe difficulty breathing or shows signs of respiratory distress, hospitalization may be necessary for close monitoring and treatment. When to seek medical attention. Most cases of croup are mild and improve within a few days, but seek medical attention if the child has difficulty breathing or struggles to speak. Stridor. The high-pitched breathing sound is present at rest or becomes worse. Lips or face turn blue. Cyanosis indicating insufficient oxygen. The child is excessively agitated, lethargic, or unable to drink fluids. Symptoms worsen or do not improve with home care. Prevention. Good hygiene practices. Regular hand washing and avoiding contact with sick individuals can help prevent the spread of viruses that cause croup. Flu vaccine. Since influenza viruses can cause croup, ensuring children are vaccinated against the flu can reduce the risk. Avoid smoking. Exposure to secondhand smoke can irritate a child's airways, making them more susceptible to respiratory infections. Prognosis. Croup is typically self-limiting, with most cases resolving within 3 to 7 days. Symptoms are usually worst during the first 1 to 2 days and gradually improve. While it can be alarming, especially when a child is struggling to breathe, the majority of children recover fully with supportive care. Severe complications are rare but can occur in cases of bacterial tracheitis or severe airway obstruction. Conclusion. Croup is a common and generally mild respiratory condition in young children, marked by characteristic barking cough and stridor. While most cases can be managed at home with simple remedies like humidified air and hydration, more severe cases may require medical treatment, including corticosteroids or nebulized medications. Recognizing when medical attention is necessary is crucial for ensuring proper care and preventing complications.